Hello everybody and welcome to Menopausal Hormone Therapy, Myths, Methods and Magic. I'm Dr. Allie and I'm going to take you through some ideas, and you're welcome to ask questions in the chat while we talk. Menopausal hormone therapy has been very much in the public eye over the last couple of weeks. For those of us going through perimenopause, of course, it's been top of mind for a lot longer than that. But for many, it's been very helpful that there was a recent Channel 4 television program that highlighted some of the challenges that people have been experiencing and yet thinking that they're on their own. So I'm Dr. Allie. I'm the hormone success doctor. I have a long history of in complementary therapies. My interest in complementary therapies actually started when I was 17 and I broke my back in a car accident. So it all started there, really. I was being told at medical school that pharmaceuticals have the answer to everything, but I knew that they didn't. And it all stems from there. I also have a background in farming and the environment, always been passionate about the earth and ecosystems, and could see that there were problems with some of the pharmaceuticals that we use. So I've spent 12 years working in the local urogynecology clinic in Eastbourne, which specializes, we're an award-winning team. We specialized in prolapse and incontinence and atrophic vaginitis. So I have that background, as well as being a GP for 22 years now. And I trained in bioidentical hormone therapy in 2013 and functional medicine from 2014 onwards, and other areas as well. So I'm a member of the Royal College of GPs. I'm associate of the Royal College of Obstetricians and Gynecologists, and I've also done the family planning training there. So there's a lot of background that I have. But what I think is more important to many of us is that I've actually been through it. So I first experienced burnout, which I now feel was related to perimenopause when I was 38. So I know that these things can be a problem from an early stage. Okay, so I've got somebody here just contacting me. I'm just going to stop the share for a second while I let her in, because I've just got to find the right link. There we go. Always a challenge. There she is. It's very strange, and it's not showing me my it's not showing me PowerPoint for sharing again. So that's really irritating, but probably because of that. So let's see if it works now. Just bear with me. That's more like it. So it's because I still had that showing. Okay, so from the slideshow from the current slide. Right, so now we've let Charlotte in, although she's not showing, so
I'm here.
Ah, there she is. There you are. Right. Great. So thank you for messaging me. I'm sort of keeping alert and multitasking, which is just fine.
Yeah, so I couldn't find the link.
Thank you. Yeah. So that's my background. And I've experienced burnout and adrenal issues when I was 38 and thyroid issues when I was 46. insulin resistance. I have a strong family history of diabetes. So I have the experience of going through all these hormonal dysfunctions that happen in our 40s, as well as having that experience as a professional with all that training. Okay. So just to let you know, this information is not intended to replace a one-on-one relationship with a qualified healthcare professional, and it's not intended as medical advice. It's intended as a sharing of my knowledge and information from my research and experience. And I encourage you to make your own healthcare decisions based on your own research and in partnership with a qualified and trusted healthcare professional of your choice. We're also going to be using a recording of this for my publicity. So if you don't want your face and name to be showing, then change your name on the screen and keep your video off if that's okay. But I'd love to have you taking part. So hormones. Having been trained in hormones for a very long time, I was a bit surprised at one of the first Athena groups, one of the first women's business networking groups that I was in, when a highly qualified accountant said, hormones are scary. And I hadn't really appreciated that these medical terms, even one as simple as hormones, can be quite intimidating for people. So hormones are simply chemical messengers. They are messages that circulate in the blood, as opposed to the neurological messages that circulate through the nerves that tell one part of a body to react in response to what's happening in another part of the body. And today we're going to cover 3 of the myths around hormone therapy. And these are really top of mind at the moment following the television program last week. 3 methods that help my clients and patients to set themselves free from hormone issues, and 3 magic tips to take home and start using today. So when we're looking at eating, at holistic medicine and a more holistic approach, we need to be thinking about supplementation. We need to be thinking about eating. We need to be thinking about a lot more things than just having hormone therapy. And lots of people want to approach menopause as naturally as possible anyway and avoid hormone therapy if at all possible. So there are 3 secrets to menopause success. You can actually get your energy back and be twice as productive within a month with 1 key change. Just let Sharon in. And another secret is that you don't have to spend 6 hours a week at the gym to get fitter and improve your symptoms. So we tend to think that we are stuck with our energy lack at the place that it is. We tend to feel that we've got to work at the gym really hard if we want to make a difference, and that's not necessarily so. And even that insomnia that is so big a problem when we're in our 40s and 50s can be improved just by a few tweaks and a dedicated weekend. And that is what I'm going to reveal to you today. I'm going to share that with you today. So we need to be thinking about our holistic health, including our relationship to other people, our relationship to the earth, and our relationship to ourselves. So I feel it's really important to learn to be at peace with yourself as part of all of this. So these results aren't typical. Yeah, Robin, I'll answer that at the end because that's quite key. Great question. So results aren't typical. I'm going to show you through the system that I use to get great results with my clients. And my results are not typical because the average person who attends any training gets 0 results because they don't tend to implement it. So I'd like you to make sure you've got pen and paper to hand, because there will be things that you're going to want to jot down as we go along. Because you'll want to make it relevant to your own life and your own experience. And each of us is an individual. We are not a factory production. We are not all the same as each other. And that's where personalized treatment and personalized management plans are key. And the best person to create that personalized management plan is you, because you know your likes and dislikes, you know your past history, who you've seen before, you know all of these things. Okay. I'm happy to share with you exactly what's working for me today. but it's not a quick fix. And I get it. We are all busy. We've got too little time. We've got too much on. We've got too little time to actually do all the research ourselves. We've got these symptoms that are cramping our style. They may be stopping you making a success of your business. They may be stopping you within your relationship. It may be stopping you from making the friends that you want to. It may be stopping you from accelerating in your career and getting the promotion you want. It may just be stopping you. But much as we would like there to be a quick fix that's the answer to everything, there isn't. And we need to be aware of that and not looking to be made better by somebody else, made better by a prescription. Okay. So as a doctor, yes, I am a doctor, I'm a medical doctor, but I take a much more holistic approach. And my days with the white coat are long gone, although I still use a stethoscope most weeks. So I've got limited time with you here today, and I am going to draw back the curtain on a way of improving your health and hormone balance so that you have a better future yourselves, because we are living in an era when women live for another 40 or 50 years after menopause, and we want those years to be the best years of our life. So if you stay until the end, I'm going to give you 10 tips for sailing through menopause, and that's a report which will help you with things like insomnia, anxiety, flushes, flashes, and sweats. We don't want to be a hot, sweaty mess anymore, and getting your mojo back. So that exhaustion that is so much a feature of menopause, that lack of self-confidence, there are ways you can get that back. So I recommend that you turn off your mobile phones. Tempting though it is when we are so busy and so used to multitasking, turn off Facebook and your emails. Or I'm going to keep mine on so I get messages from people who can't get in, of course. But if you're a busy woman in her 40s or 50s, you're suffering from exhaustion and overwhelm and that lack of sleep, you're serious about getting better results, resolving menopause symptoms, then the next 60 minutes are going to be a game changer for you. So when I burnt out, I was working full-time as a GP. I was working long hours and I was becoming disenamored of the whole GP process. So I've been really very ambitious up until that point. And I know many of you may feel the same, that you're ambitious and then suddenly it's like something's knocked the stuffing out of you. I had 2 young kids and I wasn't seeing enough of them. And I was just in a jittery, stressed wreck of a mess most of the time. I was snapping at the staff. I was snapping at the patients. My best way of working as a heart-centered practitioner is to work heart to heart with people. I like to be able to create, I work on creating rapport. I establish rapport in a way that makes people feel heard, and that's really important to me. And what was happening to me when I was burning out was that I was just short with people. I could no longer connect heart to heart. I don't know if any of you have experienced anything like that. Do message in the chat if you have had burnout and felt that problem. So there's no real difference between a hot flush and a hot flash. Some people say that it's the Americans that say hot flash. It certainly confused me when I started on this journey. So I was just a jittery wreck, and it was when I was crying between patients. My practice manager actually was the person who told me I needed to stop and take a break. And that's difficult for a practice manager to say to one of the partners, because I was her employer. But the other partners were male. They didn't get it. They didn't understand about perimenopause. They didn't understand about burnout. Fortunately, they were very they were very understanding when I went through this process. And part of my recovery, key to my recovery, was developing a deeper connection back with my roots in the countryside, and getting back into meditation and mindfulness, and developing energy healing. So this, I feel, is key, because it's not just the stresses that we are under that matter. It's our response or reaction to stress. So we want to transition from a place where we're reacting to stressful situations to when we respond to stressful situations, when we remain in our relaxed state and we are able to think things through more clearly than when we fall into the sympathetic fight and flight nervous system. And the reason I'm touching on this during a menopause talk is that in my experience, everybody who is going through perimenopause and having symptoms has an element of adrenal issues involved. And I was one of those. So who am I? I've just talked a bit about that already. So I've got now 24 years of experience, spent 12 years as a specialist in incontinence, prolapse and gynecology, including atrophic vaginitis, which is such a big problem. Vaginal dryness and atrophic vaginitis, it's that big unmentionable. So is the incontinence, incidentally. And I keep forgetting to mention the incontinence and bladder problems in my marketing. It's really important to recognize these things that we can't really talk about. And I've specialized in functional medicine and hormone balance. I'm certified with the Institute for Nutritional Endocrinology as a nutritional endocrinology practitioner and health coach, and a gut health coach, because gut health is involved in every case of hormone imbalance. And I experienced chronic pain from the age of 17 for 25 years. So I have experienced what it's like being in the place of the patient in many different ways. And then I developed these various hormonal imbalances going forward. And I knew that medicine doesn't have the answers. But health problems can really only be addressed with a combination of mental, physical, and emotional or spiritual approaches and personal development. And these are the key. We have been brought up in a culture with the NHS in the UK of going to the doctor, giving up our health to the doctor, giving up our responsibility for our health to the doctor, and expecting the doctor to make it better. But that doesn't actually happen. And this is what I discovered when I was working with, when I went through adrenal fatigue and burnout myself. Only I could make myself better. And I knew as a doctor that I knew nothing about adrenal fatigue. I'd never even heard about it. In fact, I'd never heard of adrenal fatigue until later when I trained in nutritional endocrinology. And incidentally, adrenal fatigue is not a diagnosis and it's not recognized by the medical profession, but it is a really useful phrase because people get it without it being jargon. That you know that your adrenals are involved in stress because of adrenaline, and you know that you're fatigued, and so it makes sense. So we need to be using all of these things together. I grew up on a farm and I'm committed to environment and sustainability. So it bothered me when the news came out about artificial hormones getting into the water supply, not only from the pill and HRT, but also from plastics, and causing problems with the wildlife and causing sex change in fish. That's got to be a problem for us as we move on, with environment and the global warming and all of these environmental issues that are affecting us. So we need to be involving mind, body, and soul. So holistic medicine involves taking a history. A lot of that can be done with questionnaires, which shortcuts it a bit from the point of view of time. But taking a good history, even in allopathic medicine, is an important factor in making a diagnosis. So it involves taking a history. It may involve labs, but if you use the right questionnaires, and I have some really good tools to accessible to me, you can actually make a diagnosis without lab tests, but lab tests give us much more specificity. And holistic medicine also involves using a holistic approach, including traditional Chinese herbs, English herbs, supplementation are key, and diet and lifestyle and sleep hygiene. All of these things will contribute to improving your menopause experience. So you're in the right place if you suspect you have hormone issues. If your periods are getting irregular or have stopped, or they may get more frequent, they get heavier, they may get lighter, they may get more far apart. You have difficulty losing weight, which is a very common symptom of perimenopause. You may be having hot flushes and insomnia. You don't feel too good down below, and this is the unmentionable bit. So, or you may be concerned about the future. So some of the problems that menopause have on our future health and ill health are osteoporosis, which is the thinning of the bones, which is accelerated when the hormones go down as we go into menopause. Cardiovascular disease increases quite suddenly for women. So in the premenopause years, women have a far lower risk of heart disease than men. But once we get to menopause, we catch up very rapidly. Stroke is aligned with cardiovascular disease. It's actually the same pathological process going on within the arteries of the heart and the brain for cardiovascular disease and stroke. And breast cancer, we know that we are at high risk of breast cancer. It's the commonest cancer in women, and 1 in 12 of us will develop breast cancer. So it is a real concern. And dementia, how many of us, when we are going through our 40s and 50s, go through the situation I have, where my mother has dementia and my mother-in-law had dementia before she died this February. And dementia is a real concern. And then when we start getting the memory loss, the confusion, the difficulty making decisions that are part of perimenopause, it worries us as women whose parents, we've seen our parents or aunts or uncles going through dementia. This is a real problem. So we want to try and avoid reaching the hospital. We want to try and maintain our health so we never end up here. And there are these other annoying symptoms: weight gain, headaches, feeling anxious about all sorts of little things. I remember lying awake at night worrying about everything. I'd go through everything and it would just keep me awake for hours. And, I'd be worried about the decisions my son was making, because at the same time, we've got our kids going through teens and leaving home. We've got the empty nest syndrome. There's so many things going on. But at the same time, when we sit back, are a little bit mindful and reflect, we may find that 10 years previously, we may recognize we wouldn't have felt as anxious about that. Lack of focus and overwhelm, gut issues, and inability to complete tasks, mood swings, difficult relationships, and that could be relationships at home and at work, and loss of muscle mass. So you may notice that you're weaker, and loss of libido, another of the unmentionables. So this lack of sex drive that goes hand in hand with perimenopause. So these are annoying symptoms. They may be less overarchingly worrying than some of the others. They're certainly things that you are less likely to relate to the perimenopause. You may think that it's something else. You may think it's just you being, I've heard people say, I just feel like I'm pathetic. I feel I should pull myself together. I feel I should just grin and bear it. And these aren't necessarily, these are all symptoms of hormone imbalance. So there are so many things that can be impacting us at this time. So I'd like you to pause for a moment, and I'd like you to close your eyes and take a deep breath. And I tend to go straight into it, but I really feel it's so important to pause and be mindful. So I'd like you to close your eyes for a moment. Feel your feet on the floor and take 3 deep breaths. And just feel more relaxed. Feel your muscles relaxing. Feel your heart rate slowing. And I'd like you to imagine what your life will be like when you have renewed energy and vitality. You never have to worry about hot flushes and those sweats waking you at night. Never worry about having to change your nightwear and your sheets. Imagine what it will be like when your anxieties and worries are a thing of the past because you have it handled and you have techniques for managing that. Imagine when you can be twice as productive during the day and still have the energy for playtime in the evening. Will that make a difference for you and your family and your work colleagues and your employees, your business, your income? This often impacts finance in a lot of different ways. And being able to sleep well at night is so key. So when you're ready, you can open your eyes, rub your hands together, bring yourself back into the room. And what if you could free yourself from the hormone prison? Because some people do feel imprisoned by their hormone balance at this time. And in our 40s and 50s, it can really feel like we're trapped. So did you know that hormones actually control everything in your body to a greater or lesser extent? The thing is, everything is multifactorial. So our gut microbiome impacts everything, our nerves impact everything, but our hormones impact everything as well. So the hormones, if we start at the top, our hormones impact our nervous system. They impact blood sugar, that's related to insulin and glucagon. They impact our cardiovascular system, our respiratory system, our immune system. So right now, over the last year, our immune system has come to the fore in importance. Growth and repair, metabolism, detoxification. So how our livers work at detoxifying everything we put into our body, everything we breathe in. So when we breathe in pollution, if we take a paracetamol for a headache, if we have an alcoholic drink, if we have a cup of coffee, and if we have medication, these will all impact and need detoxifying. And so our liver health is key, and our hormones affect that. Our emotions. So our emotions are so important to how we feel in ourselves and our happiness in life. And these are affected by our hormones. Sleep is affected by hormones big time. So things like our DHEA level and our melatonin level and growth hormone level impact sleep. Insulin will stop sleep. And our stress response, of course, is made up of our hormones. It's related to adrenaline and noradrenaline and cortisol, and then DHEA as we calm down after a stress situation. Hormones also affect appetite and digestion. So what is real hormone success? So my system is the hormone success system. So what is real hormone success as opposed to just a superficial attempt at it? It's about going deep, not just paying lip service, not just putting a sticking plaster on the problem. It's about accepting and acknowledging that there's no quick fix. Often these symptoms have come on over years and are based on our lifestyle over years. And so it's not going to get better overnight. And we're going to take all hormone systems into consideration, not just look at the sex hormones in isolation, as if the thyroid hormones didn't affect them. So does it work? Well, these are some of my clients. One said, you get so used to feeling awful that it's a surprise to begin to feel like a normal person again. Another said, now I just feel me again. This is what happens when you actually get to the root cause and you really get on top of the hormone problems. So 3 myths around hormone replacement therapy and menopause. So the first myth is that we feel we just have to put up with the symptoms. We think that we've just got to put up or shut up. And because our partners often have no understanding of what we're going through, and because we don't feel like we can tell them what we're going through. So why do we think that we've just got to put up with it? Partly it's because menopause is natural. Yes, it is. Menopause is just the cessation of periods. Menopause is just when our periods stop. The last period is called the menopause. And it's only diagnosed 12 months later because you may have erratic periods for a time. And it's only called the last period when you've had 12 months free of them. So yes, menopause is natural, and you don't have to experience symptoms if you are taking the right supplements, you are doing the right lifestyle changes, and really healing your gut health and healing your other hormone health. then menopause is natural and without symptoms. But 80% of women have symptoms that are debilitating and impact their lives. I have to put everyone else first. This is so much the mantra of women who have families, and even women who don't have families. It's been accepted as the place. My sister, she doesn't have kids of her own, but over the last 10 years, she spent her entire life, although she's a highly trained accountant, she's working really hard at that, but at the same time, she's putting everyone else first, and she's helping to sort out my dad's finances as he's in a nursing home, my mum's finances as she's in a rest home. She's all the time, and she was managing the books for my dad's business, always putting other people first, just because we feel like we should, because we're a woman, and because it comes naturally to us. We are natural carers and healers. I should pull myself together. Sometimes we get cross with ourselves. Oh, why can't I remember that? I should just pull myself together. Does this sound familiar to anybody? I am powerless. Women feel powerless. They feel powerless in the workplace. They feel powerless in their relationships because it's just not done to talk about menopause and say, look, I'm sorry I shouted at you just now. I just couldn't control it. They feel powerless in so many ways, and they often feel powerless when they go and see the doctor even. I should suffer in silence. This is what we've been told. We've been told to not talk about the menopause, and fortunately, we are now talking. We're not going to be shut up now. So another of my clients said that hot sweats go hand in hand with bad sleep, which is absolutely true. But now I no longer feel a sweaty mess the whole time. This is what happens when you get your hormones balanced fully. So let's look at the second myth. The second myth is that all HRT is dangerous. HRT is hormone replacement therapy. BHRT is bioidentical hormone replacement therapy. The British Menopausal Society refers to it as body identical hormone replacement therapy. So let's have a look at it. So research can be misinterpreted. We're just going to cover a little bit about statistics, only a little. I don't want to talk down at you, but I don't want to have too much jargon. I know it switches people off, and we've all got things to do. So I appreciate your attention today. Observational studies are the ones where we're just observing over time what's going on. So it's not like a randomized controlled trial where you're intervening. Observational studies are just observing. So observational studies suggested that HRT use was associated with lower rates of coronary heart disease, such as the US Nurses Health Study in 2000. And that's what you do when you're observing what's going on. You're asking healthy women about their use of HRT at baseline. So you may find that in some of the studies, they've taken a moment in time and they're asking what women were doing 10 years ago, 5 years ago. Nobody has a great memory on these sorts of things. It's not an accurate type of study. Randomized controlled trials are considered the gold standard of medical research. However, they do have flaws, they do have problems, and they are trying to generalize about an entire population of women for when you are making decisions about one person, either yourself or as a practitioner, or the client you're working with. So randomized controlled trials are designed to determine the benefits and risks when a certain medication or a certain intervention is taken for chronic disease prevention. And in this case, the Women's Health Initiative was in healthy postmenopausal women. And this is the key. So my introduction to this is that in 2002, this trial was stopped. We were told as doctors that the risk of breast cancer with HRT is far too great. You must stop prescribing HRT. At the most, we were told people could have it for 2 years, but the media got hold of it and blew it out of proportion. We were fed misinterpretations in how it was, in how the research was dealt with, and it seemed to show an increased rate of invasive breast cancer, coronary heart disease, stroke, pulmonary embolism in those on combined estrogen plus progestin compared to placebo. And here's one of the media headline. So risks and benefits of estrogen plus progestin in healthy postmenopausal women. So this is the actual original paper. So this is what the Journal of the American Medical Association reported. This was the principal results from the WHI randomized controlled trial. So you've got it's risks and benefits of estrogen plus progestin, principal results. So that's the way the medical literature reports these things. This is the way the Daily Mail reports it. So August 2002, your media says HRT can double the risk of breast cancer. How scary is that? The truth is, you'd be mad not to be impacted by this. And even we doctors were told this was an unmanageable risk. But then the same paper in 2016 is saying hormone replacement therapy boosts declining hormones. For years, HRT was widely regarded as a wonder drug for women until a 2002 study found it could increase risks of heart disease and strokes. Research also linked it to increased risk of blood clots and breast cancer. And as a result of this, number of women on HRT dropped by more than 50% since that study in 2002. And gynecologists now say that the risks are actually very small when put into context. These are excerpts from the Daily Mail article in 2016, and this is what is the case. And we're going to talk a little bit about progestins, but there are different forms of HRT, and there are some that the ones that were used in the Women's Health Initiative trial were the worst risks in the most risky patients. It was women over 60. Now, we don't tend to start HRT in women over 60. And they've already got a high risk of heart disease and breast cancer. So it was a really badly interpreted trial that led to an underserved generation of women. So this is another of my clients. 3 days after I started BHRT, my daughter said, "You're so nice, Mummy. It broke my heart, but I was so relieved that I have an answer to my anger and mood swings. I've been seeking answers for 3 years." So women are suffering as a result of not getting the management and treatment that they deserve. The truth is around HRT and risks is it depends. So the NICE guidelines that were released in 2015, for those of you that don't know, the NICE guidelines are like a gold standard for the NHS. They are used across the world as recommendations, but they are cost-based. So we're talking about costs as well. But they're very useful, and this was put together by colleagues of mine in the British Menopause Society. So some of the downsides of HRT. There's oral versus topical versus pellets. There's chemical similarity or not. Progestogens versus progesterone. Wild yam, diazgenin. Estrogens, there are 3 hormones and receptors. So there's lots of things to talk about here. So first of all, oral, topical, and pellets for HRT. So if you go and see a traditional doctor or an NHS doctor, you will generally be given either oral or topical HRT. If you go to somebody who's astute and has trained in menopause, they will give you topical estrogen and maybe oral progesterone. But there's a lot of difference between these things. So oral estrogen increases the risk of deep vein thrombosis and has to pass through the liver before it has any effect on the body. Therefore, you have to give a much higher dose than through other routes. So I don't recommend oral estrogen at all, especially not with HRT. We do have many, many younger women on the combined pill. And that in itself is a risk. But and I try and encourage women to go on to the mini pill, which has just got a progestin. So oral is not a good idea for the estrogen element, but with progesterone, it's okay. And we'll come to that later. Topical is great. You can use topical gels or creams. You can also use topical estrogen in the vagina, and that can be really helpful for the atrophic vaginitis or the vaginal symptoms of menopause. And then there are pellets. This is a really rather old-fashioned approach to hormone replacement therapy. The problem is that it spikes to a very high blood level, which then causes what we call tachyphylaxis or receptor resistance. So if you use pellets, you get estrogen, progesterone, and testosterone receptor resistance, which then makes you develop symptoms as if you've not got enough hormones around your body, but you actually got too much still. And I took on some patients of a friend of mine when she retired to do their pellets, but when I measured their serum levels, it was really quite frightening how high their levels were when they were coming back saying, I need more hormones. And so I had to transition them over to my approach. So my approach with these is to use bioidentical hormones when I'm not in the NHS. In the NHS, I recommend topical estrogen with utrogestan, which is the progesterone that's available in the NHS. I'm going to come to the difference between progesterone and progestogen later. God, that's a lot of time. Chemical similarities. So a lot of doctors don't actually even notice that we're talking about two different things when we're talking about progestins and progesterone. But it's really important because progestins or progestogens are artificial progesterone-like molecules that actually don't mimic progesterone, except in the way that the medical establishment is wanting to. So if you give estrogen without progesterone and you've got a uterus, then you will get overgrowth of the endometrium, and that can lead to endometrial cancer. And this was found to be a problem when HRT was first introduced and when the combined pill was first introduced in the 50s and 60s. So it's really important if you've got a uterus to counteract the effect of the estrogen stimulation on the lining of the uterus with some form of this. But progesterone actually mimics our natural progesterone because it is the same as our natural progesterone. And this is the hormone that's missing when we go through perimenopause. Wild yam. So there's lots of products on the market that are wild yam. Diagen in itself, it doesn't stimulate the estrogen receptors. So you're not going to get a sufficient improvement in your symptoms just by using wild yam cream. But bioidentical hormones are adjusted from wild yam. So they're chemically altered to make them back into the same hormone as our own body produces. And the other thing that most doctors forget is that estrogens are actually three hormones. There are three hormones that are estrogens in the body: estrone, estradiol, and estriol. And we need to be using estradiol and estriol. I cover this in much more depth in my course 60 Days to Menopause Relief. I'm going into far too much depth for the time available, I have to admit. And then the receptors. So there are alpha and beta receptors for estrogens. There are progesterone receptors and there are testosterone receptors. And these can all be upregulated or downregulated. So you can get a situation, as I said, with the pellets, where your receptors are resistant. And also your thyroid hormones will affect the receptor resistance as well. So there are lots of different things that are impacting us. And then NHS and traditional medicalized approach is to use a progestogen plus estrogen, either oral or topical. And if you are going to have NHS HRT, do make sure you ask for a topical. That's either a patch or a gel for your estrogen side of things, okay? And also try and ask for progesterone. So get your pen and paper out and take notes. So the other traditional allopathic medicine approach is that you don't have progesterone or progestogen if you've had a hysterectomy. So again, they're thinking only in terms of the hot flushes, the vasomotor symptoms of menopause. And if you've had and the estrogen is very effective at treating that symptom. But and if you've had your womb removed, if you've had a hysterectomy, then their perception is that you don't need to reduce the overgrowth of the endometrium, therefore you don't need a progesterone or progestogen. However, progesterone itself, the natural progesterone, is a really good calming calming hormone. It really helps counteract the stimulatory effect of the estrogen on the breast tissue. Progesterone is really important for bone density. There are so many things that it's important for, and it's quite tricky to go against the medical establishment. The reason why the medical establishment says no progesterone if you've had a hysterectomy is because the highest risk bad HRT in that trial was using the ones with the progestogen and estrogen. So the people who hadn't had a hysterectomy and were being treated with both, but they were using these progestogens, not true progesterone. So the truth is that there are risks with all hormone treatments, and there are risks with all medications. When you take paracetamol, you're taking a risk. So let's look at different forms of HRT. So the myth number 3 is that HRT or BHRT is a quick fix. And the truth is, it's not a quick fix. It's not a good idea to just look at your sex hormones in isolation. We tend to think I can carry on with my current lifestyle, carry on being stressed, overworked, balancing too many things, multitasking, and expect the pharmaceuticals to make me better. Yes, you will get some improvement in your symptoms by taking HRT and carrying on as you were, but you're not really dealing with the underlying cause that led you to have menopause symptoms in the first place and led them to be severe enough for you to need or feel you need some intervention. So the truth is we need to manage stress, to manage sleep, to manage diet, to manage exercise and their spiritual connection. We need to have mindfulness. We need to be involving all of these aspects of ourselves in order to make the best menopause experience and to, sail through menopause and on into the postmenopausal phase when we are symptom-free and thriving again. So holistic health is the answer. We want to be looking at all of these elements of ourselves. So the truth is that the foods you are eating, the stress you are under, the quality sleep that you aren't getting, and this is a catch-22 situation, I know. Poor sleep is a symptom of perimenopause, but it's also a contributing factor to those symptoms. And the type of exercise you're doing, so you may be not exercising at all, or on the other hand, you don't have to exercise extremely hard in order to help support your menopause symptoms. And taking supplements, it may be that you're taking poor quality supplements because you just want to take one a day. Well, that's a laugh. Or you may be not taking any at all because you don't believe in supplements. You believe that if you ate the right foods, you wouldn't need supplements. And we're taught that in our culture. But these could be making your symptoms worse. So some more information from one of my clients. She just loved the smoothies. She felt it's well worth taking the time to make them, and she felt so much better when she was on them. So myth number 4, a bonus myth. So the other thing is that feeling that I can deal with my menopause and PMS symptoms by just managing my sex hormones and the other hormones don't matter. And as I've explained throughout this talk, really, all the hormone families interact with each other and they all impact sleep. They all impact our stress response. They all impact our appetite and digestion. There are organ-specific hormone families, blood sugar hormone families, metabolic rate. So insulin impacts our metabolic rate. Thyroid impacts our metabolic rate. Reproduction. So if you have subfertility problems, then that could be thyroid, it could be adrenal fatigue. There are all these things interacting. And so it's much more complex than you would have thought and much more complex than you could possibly cover in the NHS, because I only have 10 minutes a patient, including the time it takes to read the notes before I ring them up. Nowadays, we're mainly on phone calls. So I have 2 heads. I'm an NHS doctor 2 days a week, and I just can't even start to go into this sort of detail. So the truth is that all hormone systems interlink together. The body works in an intricately organized balance. And as I've mentioned before, the gut microbiome is key as well. So anyone who's experiencing menopause symptoms is bound to have an element of leaky gut syndrome or intestinal impermeability syndrome. You cannot treat one without checking out the others, although we do in the NHS because we're shortcutting everything, of course. But if you want to really go deep on it, it's worth finding a practitioner who you can who you can really work closely with and look at all these organ systems and really work closely with and develop your own lifestyle plan in a way that enables you to tweak it as you go forward. And I don't put this slide up just to intimidate you because with long words, but it's really important to notice these things. So this is the adrenal hormone pathways, but it's the adrenal and sex hormone pathways. First of all, I'd like you to note at the top of the page, cholesterol. So cardiologists want us to get our cholesterol so low that we've got hardly any left. But in actual fact, what happens when you go on a low-fat diet? Very often you feel depressed. Cholesterol is actually really important for our mood, for our neurotransmitters, and also for all of these hormones. Now, cholesterol becomes pregnenolone, which is a grandfather hormone, and that goes on to become progesterone, DHEA. These are the 3 estrogens I told you about, cortisol and cortisone. Now, what happens when you are in a overstressed state for a long time? And many of us live like this. We are trying to run businesses or be a good employee or develop our careers. We're trying to manage our parents. We're trying to manage our teens and 20s. We're trying to manage our home. It's not surprising we're stressed. We've got so much on our plates. What happens when we're in that constant stress state is that all of these hormone systems chug through to the cortisol to keep boosting the cortisol, because the cortisol situation is a life-threatening situation. Your body thinks that cortisol is the highest priority because if you've got a high stress level, it's probably your brain, your body is thinking it's probably because you've got a bear about to eat you and you've got to run away or you've got to fight back. So this is why it prioritizes cortisol over all these other systems. So if you are in a high stress state, we get reduced progesterone, we get reduced estrogens, we get reduced DHEA, and DHEA is pivotal because it's a hormone that helps us recover from stress. It has the calming hormone at the end of dealing with this acute stress. And so we get this thing called cortisol steal or pregnenolone steal, where cortisol is stealing these products away from pregnenolone. And I'd also like to add that there are vitamins and minerals that are needed to help these along. And each of these arrows includes vitamins and minerals. And this is why vitamins and minerals are crucial to your menopause experience. But this is why highly stressed equals worse PMS symptoms, for example. And there's more to that, obviously. So 3 truths of menopause success. First of all, you can get your energy back and be twice as productive within a month with 1 key change. Truth 2 is you don't have to spend 6 hours a week at the gym to get fitter and improve your symptoms. And truth 3 is you only need a few tweaks in a dedicated weekend to start sleeping better and waking refreshed. I'll just see if I covered that further. No, I didn't. Okay. So you can get your energy back and be twice as productive within a month. Getting your energy back is as simple as taking the right supplement program. So if you take the right supplement program, and I'd just like to warn you, I take optimal, most concentrated supplements that exist, and I take 16 tablets in the morning and 8 in the evening. 1 a day doesn't hack it. There's no way that I would have the energy to keep doing this and running my business, and I have been that through the last 20 years if I hadn't been taking these supplements. Actually, I've been taking them since 2008, so that's 13 years. Truth 2, you don't have to spend 6 hours a week at the gym to get fitter and improve your symptoms. The right exercise is key, but bursts of exercise, so 30 seconds, stop, and then 30 seconds, 4 times a day, is just as effective and it's helpful for hormone balance and for muscle. And weights are really important as well. But you can try to incorporate into your everyday life. So one of the simplest things is to make sure you run upstairs whenever you get the chance, rather than walking. Run, sprint. I sprint. So my morning routine involves 2 bursts of exercise. I go outside, I stretch. Then I sprint down the garden with the dogs. I let them do their business while I do a few, just 2 yoga positions, stretch again, and then I sprint back up again. So there's been 2 sprints with a break in between, and this optimizes your growth hormone release. And then bringing in the weights, I do it by doing logs, getting the logs in for the wood burners. If you can incorporate weights into your everyday life, then it's easier to do it. But if you love the gym, and the great thing about the gym is that it's measurable, then carry on doing that. And, you know, and work with a personal trainer who is experienced with perimenopause. There are plenty who are specializing in this area. And then a few tweaks in a dedicated weekend. First thing is to set aside a 3-day weekend where you are going to stay in bed 12 hours, Friday, Saturday, and Sunday, or Saturday, Sunday, and Monday nights. You don't necessarily have to sleep for that whole time, but you're resetting your body clock. No screen time. You just have something like a book to read or a puzzle book to write in, or a journal to journal in. And you're just setting this time aside, and this is your I call it your menopause vacation, your hormone vacation. And this is absolutely key to resetting that body clock and allowing that sleep to improve. But in addition, learning to release the stresses and learning to do those deep breathing. So breathing exercises are key. I only touched on it earlier on because we just didn't have time. But breathing exercises are key for moving you, transitioning you from the adrenal fight and flight phase that keeps you awake and alert and on edge, to the parasympathetic phase, where you are using your parasympathetic system. You're in a much better space for sleep. You're also actually in a much better space for digestion. So it's important to take these 3 deep breaths and do some appreciate the food on your plate just before meals, and start your day with it as well. So start learning these breathing techniques, and they can make a big difference to that sleeping better. There, I have lots of other tips for sleeping, obviously. And the best way, so what's the best way forward? You could improve your symptoms now to allow you to get motivated and move forward, while underpinning that with understanding and creating a lifestyle plan that's long-lasting, self-adjustable. So my aim is to empower and inspire people, women, to be independent, but to really take back ownership of their health, their happiness, and their hormones through a deeper understanding of their health and a more profound connection with their soul. And the aim with that lifestyle plan that you are able to adjust is reducing your dependency on doctors or your feeling of overwhelm from looking at the internet and seeing so much available there. So this is one of my clients who, within just a 3-month period, these symptoms reduced massively. You know, painful intercourse, hair loss, lack of sexual desire, vaginal dryness and vaginal infections, wishing to be alone, difficulty concentrating, difficulty having orgasm, dry skin or nails, anxiety, feeling depressed and hopeless, poor memory and forgetfulness, and having racing thoughts. All of these were reduced massively within 3 months using my system, not just the bioidentical hormones. They can help you get in the right space and feel like you're making a difference, but the other stuff and the understanding that comes with it are key. So are you ready to take charge of your health and your hormone balance, I wonder? Isn't it time you found some help for those hot flashes, the insomnia, the paralyzing indecisiveness, and the down there problems? These are the things that really can make our life a misery, make it really difficult to be productive at work. So is it time that you discover the things that you can eat and how you eat that can make the difference to your menopause symptoms? And isn't it time to learn how to exercise to get the best and most trouble-free menopause transition? So I'm going to tell you about the 7 steps that I use to help women to manage their menopause and free themselves from this hormone prison that keeps them feeling trapped. First thing is pausing and connecting. So pausing, I can't stress enough how important it is to manage our stress levels, and to do this, we need to start by pausing and just reflecting on where we want our life to be, where we want our health to be, how important is our life. If we are spending the whole time running after other people, actually we're not going to be there for them if we carry on at this helter-skelter pace. And I say this with love because I've been there. Connecting to the earth, connecting to source, connecting to God, whatever you believe in. But this is part of that whole process of just taking a step back and looking at things in more depth. And this is explaining why you need to stop before doing anything else. Then you need to understand. So understanding a bit more about these hormone symptoms, although it may feel a bit scary to be talking about estrogen and progesterone, it's actually really empowering to have that understanding, but not only an understanding of hormones generally, but an understanding of your personal hormones, whether through the questionnaires that I use or whether through lab testing. And this is lab testing that we can't do in the NHS, I hasten to add. And how that understanding helps you to be more likely to help to stick to your plans. So if you have an aspiration to improve your health, if you don't understand that this tweak to your diet or that tweak to your exercise will make this difference to your hormone balance, you're less likely to stick to the management plan that you've come up with or that we've come up with together. And nourish. So we need to nourish our bodies optimally for hormone health. You may love bread and croissants, but they're not going to help you with your menopause symptoms. You need to know about the foods that make your menopause a misery and the nutrients that could make all a difference. And yes, Mary, it's a combination of vitamins and minerals, and I have ashwagandha, omega-3 fatty acids, a whole combination, but they're at high level, advanced cellular nutrition, not the sort of thing you can just buy at Boots or Holland and Barrett. Cleanse. So we need to cleanse the body and the mind. We need to release and detox. We need to allow the liver to recover from the onslaught it's been experiencing all this time. And we need to cleanse our homes as well, so that we're reducing our exposure to things like parabens. So why, where, and how you need to cleanse to get those results that you're looking for. And we need to harmonize. We need to create harmony inside and outside our body to allow your hormones to thrive. And part of this will include that menopause reset weekend that I talked of. And then we need to energize. So energizing can include exercise and fun, what, when, and how to exercise to create more rather than less energy, making sure we have fun every day. But there are specific exercises that I take you through to help you with this energizing. And then sustain. So we need to do something, put all the things in place to enable us to sustain this improvement in our hormone balance. It's not just try and let it happen by accident. We need to support that. So how to put it all together and create a sustainable lifestyle plan that you can flex with as you move on through life. So I'd like to make you an offer. I'd like to offer for you to join us on a 60-day journey, and I'll teach you my 7 steps for managing your menopause. And I'll share with you how to free yourself from this hormone prison. So this is 60 days to menopause relief, the 7-step system to get your life and health back on track. So here's what you're going to get. There's a 7-week webinar course, which is valued at $997. That's about £789. There's a step-by-step 30-day menopause makeover plan, which is $197 value. There's a hormone success system lifestyle plan for you to personalize, which is $47 value, £37. There are 2 group Q&A calls in which you will get all of your questions answered as we go through the course. So you'll get this opportunity to work with, to ask me anything that you want that relates to the course. And as you go through, because of the degree of education you're getting, you will have questions that you will want clarifying. And then you have my support recipes for everyday living to help you to balance your hormones. So that gives you a total value of $1,291 or just over £1,000. And there's my website for that. I'm also going to give you a couple of bonuses. So the first bonus is the assessment tools that I told you about that help to work out which of your hormone systems are impacting your current state of health. I'm also going to give you 2 free tickets to my virtual perimenopause retreat this year, which is going to be virtual. It's probably going to be a 2-day retreat later on in the year. And it's going to be virtual. That's how I do a lot of my work nowadays. It's great working virtually because when I share results using this technique, then like sharing the screen today for the talk, you get the same view of it as I do. And that's where you get really good understanding, because you're seeing the same as me and you're getting a recording, of course. Third bonus is going to be a hormone boost strategy session with me, and that's usually $329. And this is an example of me doing one of those hormone boost strategy sessions. So total value of all of these plus the bonuses are $3,737. The usual price for this system, for this course, is going to be $997. This week it's $497, but I'm actually giving you a special offer at the moment for only $297. And that's the website to go to for that. So if you want to lock in the price and get all the bonuses, go there now. I hope that was helpful. So the magic that in the myths, methods, and magic, my methods I've explained to you, the magic is you need to take a holistic approach, be part of a community and have ongoing support. And these are key in really helping you to sail through menopause with ease. So first tip, don't ignore messages from your body. If you're noticing that you're tired, confused, you're experiencing skin and hair changes, you're flushing and sweating, you're feeling cold, listen to those symptoms, record them, and think about how you can improve them and what might be the root cause of those. The second tip is to find out what's really happening. There are limitations to the standard medical approach, but finding a good functional medicine doctor and getting the right laboratory testing, the right questionnaires done can give you amazing insights into your health. And then tip 3 is plan forward. Have a lifestyle plan that you've been involved in its creation so that it's doable for you. It's no good having on your list foods that you absolutely hate, although I do recommend that you reflect on whether you need to enjoy everything you eat. I don't actually like the taste of apple cider vinegar, but I have it in my hot lemon every morning because I know it's good for my health and it sets me up for success. So understand enough to be able to adjust it as you go and have a buddy or coach to help you going forward. So for those of you that stuck around, I will get the 10 tips for sailing through menopause report through to you as long as you signed up through my system. So I'm going to do a quick screenshot so that I can, make sure you message me if you're not in my email system. My back office really went ropey today. So I'm just going to stop the share and stop the recording.